The drug mafia, a shadowy network of producers, traffickers, and dealers, has spread its tentacles across the globe, leaving a trail of devastation in its wake. Like a venomous serpent, it injects its poison into communities, tearing apart families and fueling violence and instability. No longer confined to the dark corners of society, drug mafias have infiltrated governments, corrupted law enforcement, and gained a foothold in even the most remote corners of the world. The United Nations Office on Drugs and Crime estimates that the global drug trade generates hundreds of billions of dollars annually, making it one of the most lucrative illicit markets in the world. This vast wealth fuels corruption, undermines the rule of law, and destabilizes entire nations. From the poppy fields of Afghanistan to the cocaine jungles of Colombia, drug mafias operate with impunity, exploiting vulnerable populations and perpetuating cycles of poverty and violence. The human cost of the drug trade is immeasurable. Millions of people around the world are addicted to drugs, their lives shattered by this debilitating disease. Countless families have been torn apart by addiction, their homes transformed into battlegrounds of despair. The violence associated with the drug trade claims thousands of lives each year, leaving communities traumatized and fearful. The fight against drug mafias is a global imperative. It requires a concerted effort from governments, law enforcement agencies, and civil society to dismantle these criminal networks and address the root causes of drug use. Only by working together can we hope to stem the tide of this global scourge and create a world free from the grip of drug mafias. The drug underworld offers a poisonous menu of substances, each more insidious than the last. From highly addictive stimulants like cocaine and methamphetamine, to powerful opioids like heroin and fentanyl, these drugs offer a temporary escape from reality, followed by a devastating descent into addiction and despair. Understanding the specific effects of these drugs is crucial in comprehending the complex challenges we face in combating drug use. Cocaine, a white powder derived from the coca plant, triggers a surge of dopamine in the brain, producing feelings of euphoria and alertness. However, this intense high is short-lived, followed by a crash characterized by anxiety, paranoia, and intense cravings. Methamphetamine, a potent stimulant, produces similar effects but with longer duration, leading to prolonged periods of wakefulness, agitation, and psychosis. Heroin, a highly addictive opioid, binds to opioid receptors in the brain, producing a sense of euphoria and pain relief. However, this pleasurable effect comes at a steep price. Heroin use is associated with a high risk of overdose, collapsed veins, and infectious diseases like HIV, AIDS, and hepatitis C. Fentanyl, a synthetic opioid many times more potent than heroin, has flooded the illicit drug market, dramatically increasing the risk of overdoses. The devastating consequences of drug use extend far beyond the individual user. Addiction places a heavy burden on families, communities, and healthcare systems. The social and economic costs associated with drug use, including lost productivity, crime, and healthcare expenditures, are staggering. It is imperative that we educate ourselves about the dangers of these substances and work together to create a world where people are empowered to make healthy choices and live drug-free lives. The decision to use drugs is rarely a simple one. It is often the culmination of a complex interplay of factors, including social, economic, and psychological influences. To effectively address the issue of drug use, we must move beyond simplistic stereotypes and delve into the underlying reasons why people, including the educated, turn to these substances. For some, drug use provides an escape from trauma, abuse, or mental health issues. Drugs can offer a temporary reprieve from emotional pain, numbing the senses and providing a brief respite from a painful reality. Others may turn to drugs due to peer pressure or a desire to fit in. The allure of being part of a group, particularly during adolescence, can be a powerful motivator. Socioeconomic factors also play a significant role in drug use. Poverty, lack of opportunity, and social isolation can create an environment where drugs seem like an escape from a bleak reality. Moreover, individuals struggling with addiction often face stigma and discrimination, making it even more challenging to seek help and break free from the cycle of drug use. It is crucial to remember that addiction is a disease, not a moral failing. People who use drugs are not bad people. They are individuals struggling with a complex health condition. By fostering empathy, understanding, and compassion, we can create an environment where people feel safe to seek help and receive the support they need to overcome addiction. Education is a powerful weapon in the fight against drug use. By equipping individuals with the knowledge and skills to make informed decisions about their health, we can empower them to resist the allure of drugs and make positive choices for their lives. Drug education programs should begin at an early age, providing age-appropriate information about the risks and consequences of drug use. Effective drug education goes beyond simply listing the harmful effects of drugs. It should address the social, emotional, and psychological factors that contribute to drug use, providing young people with the tools and strategies to cope with peer pressure, stress, and difficult emotions. Interactive learning experiences such as role-playing and group discussions can be particularly effective in engaging young people and helping them develop the skills to resist drug use. Moreover, drug education programs should involve parents, educators, and community leaders. By working together, we can create a supportive environment that reinforces the message that drug use is unacceptable and that help is available for those who need it. Investing in drug education is an investment in a brighter future. By empowering individuals to make healthy choices, we can create a generation that is resilient to the allure of drugs and committed to building a healthier and safer world. Section 5. Breaking the cycle. The role of treatment and rehabilitation. Treatment and rehabilitation play a vital role in helping individuals break free from the grip of addiction and rebuild their lives. Addiction is a treatable disease, and with the right support, individuals can overcome their dependence on drugs and achieve long-term recovery. However, access to effective treatment remains a significant challenge in many parts of the world. A comprehensive approach to treatment and rehabilitation should address the physical, psychological, and social aspects of addiction. Detoxification programs provide medical supervision to manage withdrawal symptoms, while behavioral therapies, such as cognitive behavioral therapy, help individuals identify and change the thoughts and behaviors that contribute to drug use. Support groups, such as Narcotics Anonymous and Smart Recovery, offer a safe and supportive environment for individuals in recovery to connect with others who understand their struggles and share their experiences. These groups provide a sense of community, accountability, and hope, which are essential for long-term sobriety. It is essential that treatment and rehabilitation programs are tailored to the individual needs of each person seeking help. Factors such as the type of drug used, the severity of the addiction, and the individual's personal history and circumstances should be considered when developing a treatment plan. A holistic approach that addresses the underlying causes of addiction and provides ongoing support is crucial for successful recovery. Section 6. A shared responsibility. The importance of community involvement. Combating the drug problem is not solely the responsibility of law enforcement or healthcare professionals. It requires a collective effort from the entire community. When communities come together to address the root causes of drug use and support those in need, they create a powerful force for change. Community-based initiatives such as neighborhood watch programs, youth outreach programs, and drug prevention coalitions can play a vital role in creating safer and healthier communities. By working together, residents can identify and address local drug problems, provide support for those struggling with addiction, and create a culture of intolerance for drug use. Faith-based organizations can also play a significant role in drug prevention and treatment efforts. Many churches, synagogues, and mosques offer support groups, counseling services, and other resources to help individuals and families affected by addiction. The spiritual guidance and sense of community provided by these organizations can be invaluable in the recovery process. The business community also has a role to play in addressing the drug problem. By implementing drug-free workplace policies, providing employee assistance programs, and supporting community-based drug prevention initiatives, businesses can help create a healthier and more productive workforce. Section 7. Legalization versus prohibition. Debating the best approach. The debate over whether to legalize or prohibit drugs is a complex and contentious one, with passionate arguments on both sides. Proponents of legalization argue that it would take the control of drug production and distribution out of the hands of criminal organizations, reduce violence associated with the drug trade, and generate tax revenue that could be used to fund drug treatment and prevention programs. They point to the relative success of Portugal's decriminalization policy, which has led to a decline in drug-related deaths and HIV infections. Under Portugal's model, possession of small amounts of drugs for personal use is no longer a criminal offense, but individuals are referred to treatment and support services. Opponents of legalization argue that it would lead to an increase in drug use, particularly among young people, and would send the wrong message about the dangers of drugs. They contend that legalization would normalize drug use and make it more socially acceptable, leading to a surge in addiction rates. They also argue that the social and economic costs associated with increased drug use, such as healthcare expenditures, lost productivity, and crime, would outweigh any potential benefits from legalization. The debate over drug policy is likely to continue for many years to come. It is a complex issue with no easy answers, and any policy decisions must be made with careful consideration of the potential risks and benefits. Section 8. International cooperation, joining forces against a global threat. The fight against drug mafias and the global drug trade requires a coordinated international response. Drug trafficking is a transnational crime that transcends borders, and no single country can effectively address this issue alone. International cooperation is essential to share intelligence, coordinate law enforcement efforts, and disrupt the flow of drugs across borders. The United Nations Office on Drugs and Crime, or UNODC, plays a crucial role in coordinating international efforts to combat drug trafficking. The UNODC provides technical assistance to countries to strengthen their law enforcement and criminal justice systems, promotes regional cooperation, and works to raise awareness about the dangers of drugs. Regional organizations, such as the European Union and the Association of Southeast Asian Nations, or ASEAN, also play an important role in combating drug trafficking within their respective regions. These organizations facilitate the sharing of intelligence, coordinate law enforcement operations, and work to harmonize drug control policies among member states. Developed countries have a responsibility to assist developing countries in their efforts to combat drug trafficking. This assistance can take many forms, including providing financial and technical assistance to strengthen law enforcement and judicial systems, supporting alternative development programs to provide farmers with viable alternatives to drug crop cultivation, and promoting drug demand reduction initiatives. Section 9. A future free from drugs, hope and determination for a brighter tomorrow. The fight against drug mafias and the global drug trade is a daunting task, but it is not an insurmountable one. By working together with determination and a shared sense of purpose, we can create a future free from the grip of drugs. This requires a multifaceted approach that addresses the root causes of drug use, provides effective treatment and rehabilitation services, and disrupts the flow of drugs across borders. We must invest in education and prevention programs that empower individuals to make healthy choices and resist the allure of drugs. We need to expand access to evidence-based treatment and rehabilitation services so that everyone who needs help can get it. And we must strengthen law enforcement and criminal justice systems to more effectively target drug traffickers and dismantle criminal networks. The fight against drugs is not just a battle against criminal organizations, it is a fight for the health, well-being, and future of our communities. It is a fight for the millions of people around the world who are struggling with addiction, for the families and communities torn apart by drugs, and for the countless lives lost to this devastating epidemic. By working together with compassion, determination, and a shared vision for a brighter future, we can create a world where drugs no longer hold sway, and where everyone has the opportunity to live a healthy, productive, and fulfilling life.